I was a medical doctor and I couldn't even save my parents. When Brother Roy invited me to do this talk today, he asked me a few questions. And, I looked at those questions and I say, hey, look, how can I answer those questions? One of the important things that he asked me was, what's the topic I wanted to give this presentation? And here my topic is Lifewave is a path to democratize health and wealth. And that has been my life mission for at least 5 years now. So I'll give you a little bit of background of myself. I'm originally from Kuala Lumpur, Malaysia. So terima kasih, I can speak Bahasa to everyone around who understands Bahasa. And I did my medical degree in India. So I spent a lot of years in India and I learned the culture and the people and they're beautiful people. I went back to Malaysia. And then I started doing a specialty in anesthesia and intensive care. And I had, every day I'm faced with death. I have to talk to families about letting their loved ones go, about pulling the plug on the ventilator. Those are difficult conversations to have. So every day I face a lot of death in my patients. And it made me realize that, hey, allopathic medicine is doing something wrong. We are getting more and more advanced in technology, and yet we're having an increase in the number of people suffering from chronic disease. We're having an increase in death rate, especially since the pandemic started. We have an increase of 15 to 16% per annum in death rate. There's something wrong with allopathic medicine. And that's when I decided there must be a better way. There must be. And so I go out and search for a better way. And that's how Lifewave basically came to me. So a little bit more about my story, why my mission is to democratize health and wealth. My father was a school teacher and my mother used to work for the Malayan Railways back in Malaysia. So they saved all the money they could, just like any normal Asian family. And I'm sure a lot of you can relate to that. They worked very hard. They saved all the money they could so that they can send their 2 kids, me and my sister, to a good university, get a good education, and make a good living. And that's all their intention, so much so that they did not go for any holidays. They were frugal in everything that they wanted to spend on. They didn't spend on themselves. And then I went to India, studied medicine, came back, graduated, and I went and worked at Kuala Lumpur General as an intern. As an intern in Kuala Lumpur General, close to 25 years ago, you basically work 48, 72 hours in a stretch. There's no rest. There's no such thing as labor laws and limits to the amount of work you have to do, so much so that they gave us a hostel room in the hospital so that we can go back and sleep for 4 to 5 hours and quickly come back to the ward and start doing your work. So I still remember this day very clearly in my mind. It was December the 16th. I was really tired. I finished work at 12 midnight. I went back to my hostel room and I found a pile of clothes in the hostel. And I said, I need to go home, get this washed in the washing machine, and then bring it back. So I decided to drive home that day and I reached home past 12 midnight. And I was so tired, but my mom told me that my father had been suffering from a little bit of indigestion that day. But when I reached home, I saw that he had gone off to sleep. So the thought in my mind was, when he wakes up tomorrow, I shall bring him to the hospital to see the doctor to get something for his indigestion to relieve him. So I went off to sleep. And naturally, after as soon as my head touches the pillow, I'm out. Suddenly, it was a knock on my door. It was 4:30 in the morning. My mom comes to call me. And I say, what's up, mom? I realize, it's 4:30. I have to get up and go to work because I have to start doing my rounds in the ward at 6 a.m. My mom says, come, follow me to the kitchen. Something is wrong. So I said, okay, what's wrong, mom? So I just followed my mom to the kitchen. At that time, my kitchen was very small. My dining table was a rectangle table that was set flush to the wall. And that morning, I found my father sitting at the end of the table. His head was leaning against the wall. And as a doctor, I knew that my father had arrested. And I mean arrested, meaning his heart had stopped. I and my mom frantically put him down on the floor. I started doing CPR for him. And the moment I did CPR, I can still feel it and you know, it's still the experience fresh in my mind today. I broke my father's ribs while trying to do CPR for him. My sister went to call the ambulance. By the time the ambulance came, we put him in the ambulance. I escorted him to the emergency department at the University Hospital. They tried to resuscitate my father for another 1 hour. They gave up, and they came up to me and they said it was too late. My father was classified as BID, BID meaning brought in dead. It was my father's first heart attack. It was his last. And I was very close to my dad. 3 years after that, my mother was diagnosed with cancer of the maxillary bone. I'm sure most of you would never have heard or seen anyone with a diagnosis of cancer of the maxillary bone. She was diagnosed after 6 months of having, you know, frequent runny nose. And finally, when I brought her to see an ENT surgeon, they did a CT scan for her and they found that it was impacted. When they did a biopsy, blood just poured out. It was a diagnosis of squamous cell carcinoma. She underwent a removal of her maxillary bone. She couldn't eat so well. We had to undergo 32 days of radiotherapy. I was basically fetching her back and forth to the hospital. And on the 32nd day, when the radiotherapy finished, we were so relieved, thinking that at least now we could have a break. I still remember it was a Sunday morning. Me, my sister, and my grandmother was cooking downstairs, and I could hear my mother calling out for me. So I ran upstairs and I found my mother sitting on the floor in the bathroom. So I asked my mom, "Mom, what are you doing there on the floor?" My mom said, "I just can't get up. I don't know why." So me and my sister took the blanket, we put our mother in the blanket and carried her literally into the car and brought her to the hospital. They did a CT scan for her and found that the cancer from the cheekbone had gone to her cervical 5 vertebrae. She was paralyzed from neck down. My mother passed away 1 month after the diagnosis. Both my parents, my mom was 60, my dad was 63. And that hit me like a lightning. And I wonder, why is it allopathic medicine couldn't do anything? I was a medical doctor and I couldn't even save my parents. And that's why I went on the mission. And this mission of mine, if you look at my social media, my LinkedIn, my Instagram, I always announce to the world that my mission is to democratize health and wealth. Because I'm sure all 130 of you, if not experienced this yourself, you would have known somebody in your life, your relative, your loved ones, a friend, someone would have suffered from cancer, high blood pressure, heart disease, diabetes, or some kind of chronic illness. And what does that do to the whole family? It makes you sad, right? It makes some families dysfunctional, right? So we have to find a way. What is this way? And that's when Lifewave came and spoke to me. I want to introduce you guys to these 3 wonderful, beautiful souls that came to my life. The first photo there is Cool One. I call him Cool One G. He's like a brother to me. He looks like an angel, all white. I hope he's listening here today because he's actually traveled to Singapore. He's not in Perth with me. But Brother Cool One is a very dear friend. And one day he looked at me and he says, "I need to tell you about this patch." So he introduced me to Lifewave. And he said, the words he said is so significant to me. He said, "You didn't find Lifewave. Lifewave has been looking for you all your life." The second person in that picture is Brother Johnson. Brother Johnson is in Kuala Lumpur. So what happened to me was, as soon as Cool One told me about Lifewave, I had actually had a trip to Malaysia and Kuala Lumpur. And that's when I had the honor of meeting with Brother Johnson. He traveled all the way to my place, which is at least a 30-minute drive in the traffic jam, to sign me up to Lifewave. And today, bless him, I thank him for doing that. I hope he's listening in this forum. The third person in the photo is Andrew. And I'm sure Andrew is here. Hi, Brother Andrew. Andrew has been such a beautiful soul. Every time when I have a question and I ask about Lifewave, where am I supposed to patch? How am I supposed to do this? What's the compensation plan? Andrew has always been there for me, and he's shown his leadership to be an amazing sponsor, amazing leader. And I would say if anyone has Andrew in their team, they're really blessed. So these are the 3 people. I just want to say thank you for introducing me to Lifewave. Now, this is another special person. If you look at this photo, everyone knows him, right? If you don't know him, please be aware of this man. He has exhibit a lot of humility. He's so authentic in his work. And he really, you can feel his energy that he really wants to help everyone. And coincidentally, when I look at this photo, if you see, it doesn't say VIP seat here. It says YIP, which is my surname, sit here. And he has done that for me. He has basically asked me to sit by his side, and he has guided me all the way. He's so responsive. Every question that I ask him, he's always responded immediately as long as he's awake, because we've got such a huge 12-hour time difference. But he's an amazing soul. And again, I remind everyone, Jim Rohn says, you're the average of the 5 people you hang out with, and you want to hang out with this man for sure. Okay. Can I tell you my journey and my experience now? So when Cool One, the first 3 photos of the people that you met, when they introduced me to Lifewave, what Andrew did for me was he actually gave me the Eon. He said, you give it a try. I was very skeptical. I was thinking, how can a patch without any drugs? I'm an allopathic doctor, remember? How can a patch without any chemicals, without any medicine, without any drugs, do something that is so amazing? So all Andrew said to me was, you just have to drink a glass of water. So Cool One went to get a glass of water. I drank it, and he patched the Eon for me. And I can tell you, it changed my mind. I was suddenly more alert. I could perceive my surroundings with so much clarity. And not only that, I could feel a sense of relaxation in my body. And I can sense that even though I don't have any medical illness, I don't have any medical problems, but I could sense the difference. Imagine what that can do for a person who actually have ailments. And then it so happened, I had a shoulder discomfort from trying to do pull-ups. My goal is to do 5 to 10 pull-ups in one go. I mean, crazy, but yes, that's my goal. And while I was doing that, I injured my shoulder, and Andrew put the ice wave for me. And after a while, within the next hour, I could feel, yes, the discomfort on my shoulder, even though it was very small, started disappearing. I was convinced that this thing works. And the thing that I was convinced is that I need that awareness of what's happening in my body to realize what these patches are doing for me. So the next thing I knew was my cousin gave me a call. Now my cousin is in Penang in Malaysia. He calls me after so many years of us not speaking to each other. He calls me and says, Cheng Bi, he calls me Cheng Bi. Cheng Bi, I cannot sleep. I'm only sleeping 1 hour a day. I get anxiety attacks. When I go into work, I get so much anxiety that I have to walk out from the meetings. When I go into the shopping mall, the crowd and the people around me gives me so much anxiety, I have to quickly run away. So he was suffering from so much anxiety. He couldn't sleep at night. And that's when I thought, that's a reason why someone introduced me to Lifewave, and suddenly a cousin whom I've not spoken to for a long time contacts me. I must listen to the universe. They're trying to get me to connect both of them. So I sent my cousin the silent nights and asked him, you just try this. I told him the 5 places that he could try patching it on. The next thing I knew, he texts me back on the first night and he says, yes, I fell asleep immediately after putting the silent night on, but I woke up in the middle of the night and I couldn't get back to sleep. So I went back to Andrew and asked him, what do I do in this situation? He said, put the Eon patch on him, because the Eon will then be in synergistic in working with silent night to help him to continue the sleep, because his cortisol levels must be so high with his anxiety, so much so that he wakes up and can't fall back to sleep. And I did. So I got some Eon patches and I gave it to my cousin, and this is what he shows me. So on the left-hand side is his sleep. He monitors it on his phone, and you can see that from 1 hour of sleep, it has increased to 5 hours and 53 minutes. Even him was very surprised. And he says, good morning, Chee Bing. Overall, I think it is slowly improving. Yesterday wasn't great, but better than most days, only because I slept later than usual. Technology on our phones is amazing. And that's why he could measure what Eon and what Silent Night has been doing to him. Today, he's back to work as normal. He feels like a normal functioning person, and he loves the product. Now, this is another thing that testimonial that I have to tell you guys. So me being a doctor, I've got such a left brain, scientific thinking of how do I prove that this thing actually works? So I had an idea. I decided to test glutathione because as Roy and Rick, every week they tell us that the glutathione patch can increase your glutathione level by 300%. I say, wow, that's such an objective measure. How can I go and measure this objectively? Maybe I can send my blood to the lab, measure my glutathione levels, put the glutathione patch on, and then measure it again to see how it works. But I had a better solution, and this is what happened. I met this person. His name is Samuel. He was introduced to me by a friend of mine. And you know how the universe works when you're seeking, everything just comes to you. So Samuel was introduced to me not long ago. I met up with Samuel. This is his office. And Samuel started talking to me about quantum healing. And he showed me a device called quantum magnetic resonance. This is how the device looks. Basically, it's just a box connected to your computer, and it has a handheld device. And amazingly, this device can measure your glutathione levels without any blood measurement at all. I say, bravo, this is what I'm looking for, an objective measure of how the glutathione patch works. So let me do this test. So I did, and this is the result. The first one, the first chart on the left-hand side, if you look at the bottom of the table is glutathione. My first measurement was 0.203 before I put the glutathione patch on. After that, I put the glutathione patch on just below the navel. And this on the second chart, as you can see, is 1 hour after putting the glutathione patch on. And you can see that the number has increased by 224% within 1 hour. And this was objective proof for a person like me who's so left-brained. So I say, wow, this glutathione patch really works. And if I had measured, I had to leave because it was very late. I think if I stayed there for a little bit longer and continued to measure my glutathione, I'm sure I would have seen continual improvement, probably even hitting the 300% because this was already 224%, probably hitting the 300 or 400%. God only knows, maybe even more. But I wasn't there because it was getting late at night and everybody had to go home. But this was objective proof. So what other proof do we need for that? So as you can see, even with the short period of time I've been with Lifewave, I've been having so many positive confirmations of how Lifewave works. So what is Lifewave? I decided with my left brain again, decided to go and look into quantum healing. And I would say this is a different path in medicine. We have been so reliant on allopathic medicine because that's the way we have been psyched to think that it's the only way to work. It's either drugs that we swallow or surgery that we cut things out. But I want to tell you guys that the new way of moving forward in medicine is quantum healing, not allopathic medicine anymore. We have to use allopathic medicine, yes, as a synergistic effect, because if your vitamin D is low, your omega-3 is low, you still need to supplement that. You need to create the environment for quantum healing to work. So what is quantum healing? Quantum healing is, you know how Brother Roy always at the start, he says there's a disclaimer. We do not claim that Lifewave is a medical treatment, diagnostic treatment. We do not claim all that. And why does he say that? It's because quantum healing is a way to create an environment in your body to allow the basic instinct of our own body to heal itself. I want to tell you something that you might all not realize, that the human body is so amazing. God has given us an amazing gift that our DNA has an innate ability to heal itself. I want you to know that the reason why we don't believe it is because we've not harnessed that ability. We've not given ourselves proof of that ability. It has been suppressed all these years, all these centuries, that has been suppressed. And quantum healing, what it does is it creates an environment for us to eliminate all those external toxins, the external radiation, EMF waves, all those things that we are bombarded with in everyday life, to allow our DNA to express itself and to allow our DNA to undergo that innate healing that we need. And because Lifewave does that to our energy, our chi or our chakra, as some people call it, it creates that environment that allows our own DNA to repair itself. And that's why for some people, you'll find that the effect of pain, like in Brother Rick, the effect of pain was immediate. But in some people, it will take 3 months, 6 months, or even a year or two. We don't know, because it's really reliant on your own body's innate ability to heal itself. And as Brother Roy said, in some people, if the pain doesn't go away, you must think, do they have chronic problems? Do they have diabetes? Do they have, toxins in their body? Do they have other things in their body? And maybe they need to do a detox before Lifewave can actually do its healing process. Provide that quantum healing for the own body to heal itself. So that's why sometimes you see the effect immediately, and sometimes you see the effect after a while, because again, we're relying on your own body's innate healing powers, and that everybody is at a different stage where their body is with the ability to heal itself. So I hope that that's quite clear. Okay, I want to close with this very quickly because I know we're running out of time. What is the criteria? Give it time, give it awareness, give it your consciousness, and have the belief that it works. And I want to close this by what Brother Roy and Brother Rick have always emphasized. This is my motto for life. You get everything you want in life when you help many others get what they want. Put them as a real priority. And this is by the late Zig Ziglar. I want to thank you all for the time given. I empathize with you guys, and I really salute all of you, though you're not doctors and you're trying to help the doctors change their mind. Even I'm having difficulty talking to my colleagues, so hats off, I salute you guys to try and change. Remember, there's a point of inflection where everyone will believe, and there's only 18% of the world. If 18% of the world believe in what we're doing, that's really a point of inflection when we'll grow exponentially. And that's proven in science.
Thank you so much. Thank you so much, Dr. Yip. I was so amazed by your presentation, really. Please emphasize on the last part of the presentation, because I think it is very important to us. The quantum
healing is a very totally different concept from allopathic medicine, because in allopathic medicine, we are told that we swallow a drug and we get the results. But what people don't realize is when you swallow a drug, it not only acts on the site where you want it to act, it acts on the whole body. And usually the other actions are what we call side effects. So even though we might not realize it because we are limited by our 5 senses, it doesn't mean the drug's not causing trouble in our liver, in our heart, in our gut. It's not that. And a very good example is statins. A lot of people are taking statins for their cholesterol, but what they don't realize is the statin is destroying their mitochondria, and the mitochondria is the root, the organelle or the structure for longevity in every human being. So while you're trying to reduce a number, which is the cholesterol number that you see on the lab result, you don't realize that you're actually reducing your longevity by destroying your mitochondria, because our five senses can't feel that our mitochondria is getting destructed. So there's so many side effects of drugs, whereas with quantum healing, we are actually using our own body's DNA to heal itself. Can I say that God has given us a great gift of our DNA, because in that DNA, there are possibilities of creating, of transcripting the number of proteins that we can transcript and heal ourselves is in trillions, and maybe it's unmeasurable, but trillions and trillions of protein. The reason why we don't transcript or we don't produce those proteins is because our DNA is locked in a double helix a structure, and because it is locked, it's held very closely by a magnetic field, which is the quantum field. Is held so strongly that the DNA cannot unlock itself to produce the proteins that we need to heal our body. So what quantum healing does is it actually provides us with the energy. It balances the energy in our body, and the energy consists of a magnetic field and an electric field. So the magnetic and electric field, once it gets balanced, the DNA lock will unlock itself. And the parts of the DNA that have been locked, we call it introns in scientific term. The introns in our DNA that produces the proteins that we need to heal our body is now suddenly exposed. And therefore, the body can transcript the proteins that is necessary for us to do that self-healing. So what quantum healing does is it just unlocks the introns that have been locked up in our DNA for centuries for self-healing. Does that help with your question?
Yes, it really helps. And then thank you for bringing the statin issue, because some of my patients, like, they still want to do statin because the doctor said that they have to lower the cholesterol, but some of them think that maybe I can use Lifewave to balance it, and then take some CoQ10 maybe. So do you think it's a good idea to do that, or you prefer just do the quantum without doing any like statin? So thank you so much.
Okay. One thing I must say is I cannot give any medical advice here, because it's not in my position here to give medical advice, but I can give you an idea of what you can do. When someone comes to me and says that they want to be on statin, I don't prescribe statins, by the way, because my specialty is intensive care and anesthesia, but I have people who come to me and say that they want to start statins. What do I do? The first thing I tell them to do is, have you done the chromatography of your lipid profile? In other words, have you done the subtyping of your cholesterol? So what I want to say is, for those of you who have done your cholesterol levels before, you get a blood result of total cholesterols, your LDL, your HDL, your triglycerides. That is the report that comes out. Looking at that report, when the number of total cholesterol or LDL is high, all the GP does is they just straight away prescribe a statin for that person. What I want to tell that person is, have you done the subtyping of your LDL? In other words, your cholesterol not only has these few 5 varieties, it has actually a spectrum of variety. So how do you know which spectrum of variety you actually have? There are at least 10 different subtypes of LDL. All they have to do is another blood test to do the subtyping of LDL. Why? Because when you have 10 different subtypes of LDL, if you have subtype 1 to 3, it's not dangerous at all. But because it's high, it contributes to the total cholesterol, the total LDL, and people think they have to be on statin, but they don't, because subtype 1 to 3 is actually not dangerous for you. So some people out there who are on a statin might be on the statin unnecessarily, because the LDL, the cholesterol that is high, is actually the non-dangerous subtype group. So I would advise people, the next step to do is go and do your subtyping for your cholesterol, for your total lipids. And that's when you can see the full picture of why your cholesterol is high. And cholesterol is not bad, by the way. You need cholesterol to make your sex hormones, your vitamin D. Cholesterol is in your brain. As a matter of fact, the majority of our brain is actually cholesterol. Otherwise, we won't be here talking to each other. So cholesterol is not a bad word. It is actually essential to life. So please remember that. And subtype your cholesterol if it's high to see whether the type you have is the good cholesterol or maybe the type that you need to do something about. That will be the next step. And I feel very sad because a lot of people have been given wrong advice. Some GPs, friends of mine who don't even know about subtyping your cholesterol, and they still go based on that very, very primitive result of your lipid profile. And that's really primitive.
Thank you so much, doctor. I think we have to re-educate ourselves. Yeah.
For sure.
Yeah.
For sure.
Yeah. Yeah. In functional medicine, I just find out that you are really right. And the dangerous of taking statin without doing CoQ10 and so, it's really danger. So for people like that, I just say, okay, you just take X39 lah in balance. So balance it.
But like as Peter Drucker said, you only manage what you measure. So sometimes when you tell people take X39, they might use it for a week or two, a month, and then they give up because they don't even measure their cholesterol. So they don't know what X39 is doing for them. So the best way is go and make sure that they measure and monitor and they can manage what they measure and monitor the results.
Thank you so much. God bless you, Doc.
Thank you. Thank you. You too.
Wow, that is mind awakening for me as well. Before my Lifewave, my cholesterol is around 200, right there at the borderline. And then after Lifewave, it went down to 156. I really do not know exactly what happened in my body, but praise the Lord that I'm okay. Using the patch are just amazing.
Can I just add my 2 cents worth to the opinion about cholesterol? I said, whether you are an evolutionist or a creationist, can you reason why God creates a perfect being that creates its own cholesterol as an essential for everything and cause it to be bad? That changes the thinking a bit. If you're an evolutionist, why should we evolve and come to this stage where we produce our own cholesterol to harm us? That forces their thinking a little bit. And then if that's the case, then maybe we should look at it, the whole thing from a totally different perspective and not look at the cholesterol as an extremely bad, but extremely essential, and whatever modifications we do according to that kind of a perspective. Because we have been given the idea that cholesterol is bad and all those things. But I say this is essentially good. Because otherwise, you cannot evolve like this to be perfect and cause this problem. Something is wrong, or God is wrong to make our body create our own cholesterol.
So you want to answer that, Dr. Yip?
I want to say, Brother C, is that what your surname is? Or is it Long that's your surname? Long is your surname, Brother Long. I want to say you've got really, really good insight to what the situation is. And I want to applaud you because your level of consciousness has got another step. And that's why you thought about it in that way. Yes, it is the perception of the human being that cholesterol is bad. It's because media, doctors, articles, everything has actually made cholesterol and labeled it as bad. It's a human construct. It is not actually the truth. And I think what we need to do is to re-educate people that cholesterol is actually good. And it is not the cholesterol which is bad. And the reason why I say that is because 50% of people who have high cholesterol do not develop a heart attack. And 50% of people who have heart attacks do not have high cholesterol. But why did we associate cholesterol with heart attacks? This was a human construct. I'm not accusing any drug companies that want to make money, but you know where I'm going. Okay.
Doctor, from the functional medicine, I think I learned that the problem is the oxidized LDL that makes problem. So inflammation can make it as a problem, and it's our lifestyle that can make the problem. So maybe not accusing the drug and all accusing the cholesterol. We come back to our lifestyle, and our patches really can give us like a way out, because it takes care of the inflammation, it takes care of the antioxidant. I think, doctor, maybe you have another opinion. Thank you.
Dr. Kunyati, your perception of it is absolutely correct. The reason why most of our medical studies and research have not proven anything as absolutely correct 100% is because, as you alluded to, there are so many factors that affects our epigenetics and our morphogenetics. These are two terms that are relatively new in the medical world. And what epigenetics says is basically the environment that influences the way we project our health, the way that we appear in life, the way we appear in our three-dimensional reality. So that's what epigenetics teaches us. And morphogenetics is basically the energy around us. Everything has morphogenetics. The determinant of how we come out to the world is determined by the energy around us, and there's the term called morphogenetics. But you're absolutely right to say that it is mainly our environment, the way we behave, the way we think, and our habits that determines our health more than anything else, more than all the other things that we talked about. Yes, you're absolutely right.
And ion and glutathione and everything can help us, right?
Yeah, because what they do, the Lifewave, is quantum healing. It actually provides us with that energy sphere at the quantum level. Quantum meaning very small, very, very small at the scalar level. It talks about electron, neutrons, and protons rather than the being like the liver, the heart, and all that. That's more on the macro level. So quantum is more on the micro level, and that's where it acts, and it actually aligns our body's energy to help our body heal itself. That's quantum healing.
Thank you, doctor. And then I think maybe checking the lab, and so it's not the way you tell that the patch work or not. I always said to my patient, just feel it. I don't like say like in 3 months you check your cholesterol, because I don't think it's the one to determine how patch is working. Yes, it can, but I think you have to be honest that you are feeling better, right? If you are feeling better, something must done. It's not a placebo. It cannot be placebo. Horses you cannot have. Thank you, doctor. Thank you for today.
Yeah. One more comment about what you just said. You're absolutely right. We all have to have the awareness and consciousness of what these patches are doing to our body. But I'm sure each and every one of you have tried patching someone and you have had a negative response from someone, right? And it's not because they don't feel it, not because the patch is not working. It's because sometimes people just maybe are not very aware of what's happening in their bodies. So that's where sometimes an objective result might help them see the light. And that's why we gave the objective result of glutathione, raising your glutathione by 300%, because that will help that cohort of people to actually believe, yes, it actually works, because they're not very sensitive to their feelings or their awareness of what's happening in their body.
Hi, Dr. Yip, and thank you for your presentation. It was wonderful. I appreciate it. My question that I had about quantum healing, and not to get too philosophical or spiritual, because as a pastor, I can do that. I know this is not the form, but I truly believe that God has created us incredibly. The word tells us that we are fearfully yet wonderfully made. And I believe that God has given us in our DNA all the necessary nutrients, everything that we need. But toxins, society, water, drink, whatever we do, that's what ails us. Or whatever we ingest in our body, whether it is drugs, alcohol, you name it. So I just want to thank you for touching this very important subject about quantum healing, because I believe that God has done that for us. Whether you're a believer or not, it really doesn't matter. What matters is that now we have a tool, now we have a technology that we can go and heal, let our bodies heal itself. So thank you so much for being here with us. We really, really appreciate it.
Thank you, Pastor Ed. And the message to the rest of you, I don't know whether you realize what Pastor Ed has just said, the significance of what he just said, until you experience it. We just think, yes, God has given us that gift to be great, but you cannot imagine to what extent that greatness is. And I do pray and hope one day all of you will experience that, because it's beyond. When you realize what I see, what I feel, what I've seen, it's really beyond your imagination.
That is very good. Woo, Dr. Yip, you're awakening all of us here.
I hope so. I hope so, because each and every one of you have that power. You just have to realize it. You have that power. Thank you very much.